Hello and welcome to Health Services 411, a program designed to keep you updated, informed, and educated about activities, events, and policies of the BVI Health Services Authority. I'm your host, Marketing and Communications Manager, Natasha Ledsam. Hello, for today's 411, we're in the radiology department. We have with us two radiologists who is about to give us a tour of this facility and help us to learn more about radiology and its importance to medicine. As part of Radiology Awareness Week, we have here Dr. Flax Miller and Dr. Ibali. Welcome.
Thank you.
Thank
Good
you.
morning, Natasha.
Good morning. So we're celebrating Radiology Week. We're here in your department. Can you give us a tour and educate us about the different equipment and how it is used?
Okay, currently we're in our waiting room where we have a couple of patients waiting, but we've installed for this week an informational video so that patients can be aware of what their imaging modality for today or the day that they're visiting will be. We have a receptionist area, and as you can see, we've decorated the place quite lovely. We have our mammography suite. I like to think of mammograms as being as big photocopying machines. This equipment is really top of the line. We're able to do both regular mammograms as well as tomosynthesis, which gives us a really good view of the different parts of the breast in order to decrease the patients having to come back for any additional imaging.
The technology is going to put your breast comfortably here and slowly lower down this according to your tolerance. Tell the technologist to not to press too much, but the thinner your breast is, the better the resolution of the breast image that is being obtained. But you only have 2 views for each breast. If you have bilateral mammogram, you have only 4 x-rays. For a screening mammogram, for diagnostic, we will probably have more than that. Or if you have a huge breast, probably one breast have 2 images to be taken so that we can capture all the breast tissues there.
And what about persons who have really small breasts? How do you test?
That's quite tough, but easier because it's just a small thing to compress. But most of the thin patients, we don't get the inner muscles. That's why we have to compress a little bit harder, and it already reaches the ribs. So it's just how the technology is going to do about it, manipulate about it, so that all the needed information should be included in the x-ray.
And definitely, as the first step we made was to mammography, just give us a few tips for our viewing audience who may have some concerns about when they should have mammograms done or what they should take into consideration as a woman in terms of breast cancer.
Well, there are really a wide range of guidelines in terms of when patients should be imaged in terms of their annual mammograms. I studied in Jamaica, and we started imaging at 40 because we see that a lot of the invasive breast cancers start at a younger age. In general, we start at 45. But if a patient comes to you before 45, certainly advise them that they may want to do a baseline mammogram to start with. And then we pretty much continue either annually or biannually until 74. And if you have a patient that has an increased risk of breast cancer in a first or second degree relative, then they need to start their screening 10 years before the diagnosis of that relative's breast cancer. So if that patient or their mother, for example, has had breast cancer at 45, then they need to start their annual screening at 35.
Thank you.
This is our ultrasound unit, and this is our sonographer who is going to do the ultrasound. Our ultrasound machine is a high-end machine with 6 or 7 probes in it. It's complete, and it's capable of 2D and 3D. The one thing that we can really do with ultrasound is patients have to come here for a lot of reasons, like ultrasound of the obstetric ultrasound, gynecological ultrasound, abdominal ultrasound, chest ultrasound to rule out effusion and everything. A lot of indications coming from the clinicians to do the ultrasound, and we can do it here. Even the 3-dimensional and 4-dimensional sonography and high-risk pregnancy for level 2 obstetric sonography, we can also do it here. Most importantly, recently, our radiologist, Dr. Flax, is doing interventional radiology, and she is also doing some breast biopsy, prostate biopsy, and others, drainage of cysts in the kidneys. So this ultrasound is important tool. It is a non-ionizing radiation, so it's safe. It's not emitting any radiation at all. So it's very safe for all patients. The most important thing for ultrasound is it detects cystic or solid masses. We can also see the vascularity of every lesions that you can see. All right. So a lot of things that we have to know about ultrasound, but it's not enough for this time. But if anybody who wants to ask about education about ultrasound, we are very much willing to tell you about how ultrasound works in the diagnostic radiology.
Now, you mentioned 2D and 3D pictures. What exactly does that mean, and how does it facilitate physicians in uncovering what's the underlying cause?
That's more used in obstetric cases. Patients want to see the face of their children or babies inside. You see, they want to see. Well, this is also diagnostic in terms of, you can see a hair lip in 3D ultrasound and other congenital anomalies of the baby. So 3D and 4D is not really routinely used, but the clinicians can request for that if they really wanted to check the anatomy of the fetus inside the womb of the mother. Yeah, this is the 3D probe. This is our X-ray suite room, and it showcases the X-ray machine. This is an RXI 500 X-ray machine with fluoroscopy. All right. So this is our fluoroscopy machine. So with fluoroscopy, we can see real time on the patient's, whatever studies we have. We do usually this one with oral contrast study as well as intravenous study as well when we do some invasive procedures. But commonly we are doing it GI tract like barium meal, barium swallow, upper GI and lower GI series. So this is the X-ray table. The patient is going to lie here for X-rays or whatever, abdominal X-rays, extremities. And this is the chest Baki, wherein the patients are going to have the chest X-ray they have to position like that, okay? And then if they want to do the lateral, they can do this one, and the tech is going to do the X-rays coming from there.
Now,
So,
you
yeah.
said X-ray, and probably it emits some level of radiation. How
Yes.
safe
Yeah.
is a procedure like this?
Definitely X-ray is a radiation, but for routine X-rays, radiation is very minimal. So you don't have to be afraid if you have 10 X-rays for a year. We have certain level which is cumulative that is acceptable with the normal range, because right now we have already radiation received. So same thing here, we receive radiation at a higher dose but at a medical level, acceptable and being approved by the FDA. So radiations here are actually approved by the FDA, the levels of these radiations being emitted, not with the fluoroscopy. So the fluoroscopy has to be controlled because fluoroscopy has a higher radiation doses. So it's according to the radiologist or the interventional radiologist to limit the exposure of radiation. All right. And we also have this TLD badges here. All of the radiology staff has this one. This measures the cumulative radiation that we receive in a year. If we receive more than the accepted dose in a year, that is counted as millirims, then this staff should be reassigned to another unit until 1 or 2 years that she already surpassed or he already surpassed the maximum year of that radiation that should be received. Because once you receive that radiation limit, you have higher chances of developing malignancy in 15 or 20 years. The late effect of radiation.
So what do you do to protect your staff from reaching that maximum capacity?
Of course, we have to use the ALARA principle, that is as low as reasonably achievable. But not only that, thank you, Dr. Flax. Dr. Flax brought with her a lead gown. This gown is lead lined and it's heavy. This protects penetration of the radiation to the body. So, and we have also a thyroid shield, and we have also a gloves actually. So you are safe as a technologist. You are very safe. We follow the international standard rule of radiation protection for our staff. The door should be closed. Nobody should go in while the radiation is going on, because anywhere in this room may have radiation received. That's what we call scattered radiation. But definitely after exposure, no more radiation. So after radiation, if you open that door, you don't receive any radiation at all. So these are the myth. Some people say, I don't go in because there's X-ray there, and I might have the X-ray all throughout. No. After you switch off the machine there, no radiation exposure, no radiation at all. All right?
I have one question with regards to the age of patients when using radiation and different types of X-ray. I'm not sure where I came across the information, but at some time I think I read or heard about once a child is X-rayed at a very young age, maybe under 5, they have a higher risk of developing cancer and other malignancies throughout their lifetime. How true is that?
Well, true, in a sense that if the child received more radiation at that age, the effect of radiation is actually on the biomolecular level. It's genetic, disruption. The DNA template will be disrupted and it will create another template, which is the cancer template. So the level is actually the molecular level and the genes. So that is where mutation starts. So if you receive radiation at an early age and it's more than your age, more than for your age at that time, like 5 years old, and probably the patient had already lymphoma or whatsoever, she received a lot of radiation, definitely this patient developed some form of malignancy towards the end of the 15 or 20 years after. There is really chance of having radiation. That is the irony there. X-ray is diagnostic and at the same time therapeutic, but it can also cause cancer. You know what I mean? It is a treatment for cancer, but it can also cause cancer. So that's really the truth about it. But as much as possible with young age, we always provide gonadal shield to cover the gonads, the all important organs that are very sensitive to radiation. So we have to cover that one. That is part of our general practice, that we have to cover the parts of the children that is not really intended or the purpose of the study.
Okay, here we have our top of the line 1.5 Tesla Mri Unit. It's pretty much a big magnet and it interacts with the hydrogen atoms in the body and uses radio frequency pulses to align the cells. And then pretty much we take some pictures and have a look at what's happening. So MRI is really good for soft tissue differentiation, whereas CT is more looking at bones and vessels, and it's a slightly different spin on what we're looking at exactly. So this scan takes varying from 30 minutes, 45 minutes, more than an hour, depending on what you're imaging or how many parts you're imaging as well. Yeah. So you can image from head to toe pretty much. You can look at the brain, the spine, where you're looking at the actual discs that are between the bones. You can look at certain parts of the chest. You can do cardiac MRI, breast MRI. Special thing with the breast MRI, the patients are actually laying flat, but with most of the other MRIs that we do, the patients are laying on their back. If you have a lumps and bumps all over the body, you can do that as well. So depending on where we're imaging, we'd also give contrast, which is a different type of contrast that we would give for CT. It's gadolinium that we give, and it's a much smaller dose. And most importantly, there's no radiation with MRI, so it's perfectly safe. It's just that you have to be careful for any metals that you may have. Aluminum is safe, titanium is safe once it's been in place for a while, at least more than 6 months or so. So even if a patient has had spine surgery, they can still go into the MRI machine. We have some pacemakers that are also MRI safe now. That's really something that's important. If you have implants in the ears, cochlear implants, we need to know that you have them. And if you have the insert, that's also very important because it will say whether or not it's safe, and it will also tell us the material that it's made of.
Dr. Flax, you have some pretty top-notch equipment here. I have to say, I am impressed. This is my first time in the imaging suite, and it's just another level than what I thought. And definitely, I can see advancements and steps being made for Health Services Authority in terms of their service delivery and delivering that excellent client-centered healthcare that they're referring to. When you're talking about the MRI suite now, how exactly, what is like the time frame, how long people have to be in there, And what are some of the pros and the cons of this machine? Dan, you mentioned briefly about the x-ray, but you mentioned the breast. And I'm like, okay, why would you go in here to do a breast MRI?
Right. Remember I mentioned that soft tissue differentiation is very good. So if you do a mammogram in a patient and you see things you're not sure about, especially if it's a very high risk patient, you may want to do an MRI. MRI enables the administration of contrast, and pretty much you look at how the masses interact with that contrast. We look at the kinetic levels. So it's not a screening tool, because once it's a screening tool, it has to be readily accessible and it has to be affordable. MRI is a little more expensive than a mammogram is. So it's really for a select set of patients that we would want to do a breast MRI for. Our machine, we try and make it as comfortable as possible. Some patients do get anxiety when it comes to doing an MRI, because if you look in there, it's almost like you're going into a coffin. Right? So a lot of patients do get a little anxious about that. So if you look on the ceiling, we have the picture of the sky. And so that helps calm and soothe the environment. And we can also play music to make the patients comfortable. From time to time, I do have patients that I have in CT, and if they do seem a little anxious, I do volunteer to play music for them. Whatever they want to hear, I do facilitate that, because if you have an anxious patient, there is some literature that states that you can have an increased risk of having a contrast reaction, which we really don't want to have. Also change the color of the room, so it can be green, it can be red, just to make the patients feel comfortable.
Nice. Definitely a great operation that we have here going on. And you know what? I really appreciate you bringing us in here and educating our viewing audience with regards to radiology and some of the things that you do. If you want to tell me a little bit about your staff and the classifications of persons you have working here, that would be awesome.
Okay, so our department does have several tiers. We have Dr. Barley and myself. We are radiologists, so we are medically trained physicians, and then we went on to specialize in radiology, where just like surgery, where you have the neurosurgeon, the cardiothoracic surgeon, you have radiologists that subspecialize in those areas as well, where they just literally sit down and look at the brain or a specific part of the brain all day. We don't really have that volume here, but in the first role setting, you do have lots of people that subspecialize. Brain, chest, neck, just looking at specific parts of the body. And so that's us as radiologists. I do a little bit of intervention. So I use mainly ultrasound in order to take biopsies of the liver, the kidneys, any masses that a patient may have, in order to help with the diagnosis and to lead the clinician. We have medical technologists, and they are also university trained, and they specialize in X-rays, or obtaining the X-rays, assisting with fluoroscopic studies, CT, MRI, as Mr. Klein is actually an MRI technologist, and he's very good at that. And we also have sonographers who are primarily technologists, and they have training in obtaining X-rays as well, but they have specialized in doing ultrasound specifically.
And what type of volume of patients do you get coming through here?
All right, so recently, we have a lot of immigration medicals that we do, so we do quite a bit of X-rays every day. On average, I would say we do about 20 X-rays per day, which is a lot for our little department. CT, it varies. Sometimes we may have 5 CTs in one day, sometimes we may have 1, and sometimes there are none. But, it tends to be variable. For MRI, we may do up to 4 or 5 in a day when it's functional. Unfortunately, the machine isn't up and running right now, but we hope to have it fully functional soon.
Well, awesome. As we wrap up the program, just to leave our viewing audience once again with your contact information, how they can use some of your services, and also link it back to the importance of radiology when it comes to disease management.
Right, so you can access us via the website, and that's www.bvihsa.vg. And we're on the imaging department. You can contact us via the phone at 852-7727, or you can access us via email at x-ray@bvihsa.vg. We are an open department. Today is actually our open day, so we're having tours through the department, kind of giving everyone an idea of what we do. It's important for the general public to understand our importance in medicine, and also to have an idea of what they will experience when they come through the department to have various studies done.
Thank you very much.
You're welcome.
Thank you for tuning in to this edition of the 411, where today we were at the Radiology Department learning about radiology, coming to you from the CT room. I am Marketing and Communications Manager Natasha Letzum. Thank you for tuning in.
Thank you for tuning in to this edition of Health Services 411. Please like and share this video and follow us at the pages below as we seek to improve the pulse of the people of the territory. Until next time, remember, your health is your wealth. Reporting for the BVI Health Services Authority, I am Marketing and Communications Manager Natasha Letzum.